And for example, here's a very recent study on the microplastic risk to human health, and show these active microplastics, BPA, PDDA, any of these letters and numbers, QVC. That's the name of a place on television, I guess, selling, or what is the stuff you put the VCRs and QVR, VRs, VCRs, right? Whatever. Stupid, just my stupid joke. But what I'm saying here is that microplastics is all over the place. Don't eat things out of plastic. Don't drink water out of plastic. Can you imagine people go to like places like Starbucks and they'll take a hot coffee or a hot tea and they'll pour it into cardboard cups that are lined with plastic, and they'll pour the hot liquid into cardboard cups, and then they'll drink down the plastic. It's like insanity. We're poisoning ourselves with plastic. And that's why I think most of us health seekers are realizing that we got to be really careful with seafood. Just see the food and don't eat it. Okay, so let's review what we went over here so far. Number one, exposure to phytochemicals, regular exercise, and caloric restriction, moderate caloric restriction, to keep a low body fat. Remember, you want to err on the side of eating less, not eating more. Gives us higher levels of these proteins like SIRT1 and AMP kinase, which stabilizes our DNA, prevents telomere shortening, and helps maintain stem cells when we need them as we age to keep us young longer. Whereas eating more animal protein and excessive calories, and if you overeat it, even overeating healthy food, it's particularly high glycemic food, but just eating extra calories increases your IGF-1 too high, not just extra protein, just overeating food, just being overweight. So eating too many calories, and we need much less calories than people think we need, because Americans aren't just overshooting their calories by a little bit, they're overshooting their calories by a huge amount. And everybody should know their body fat percent. I mean, I'm 70, and my body fat percent usually runs between 10.5 and 11%. So I have 11% body fat at the age of 70. I just saw a study that showed that professional NBA basketball players had an average body fat around 16%. That's the NBA basketball players who have an unfavorable body fat compared to my standards of excellence. I want people to be below 15. But my body fat at age 70 is about 11%. So if I could do 11%, you could do 14%. Just got to work at it. It's a hobby, like to stay fit and to eat right. And if you, by the way, the excess animal protein and extra calories drives mTOR, which then ages you rapidly, burns up your stem cells, shortens your telomere, and these things are measurable. We can measure the speed at which you're aging. So we're talking here about the average lifespan of Americans, which has gone down in recent years. Right? We're living 2 years shorter lifespans now than we were living 5 years ago. And overall, the short lifespans of Americans has shortened over the last, little by little, over the last 20 years. Even though it's accelerated the last few years, it's gotten worse. With all the statin drugs and all the blood pressure medications, all the diabetic medication, all the medical care, and all the best medical care in the world, we have some of the worst healthy life expectancy, the highest infant mortality rate, and the worst health anywhere. And people are just dying needlessly of cardiovascular diseases and cancer because we're killing ourselves with committing suicide with food, right? With addictive food, with so much commercial baked goods and fast foods. So I'm making this radical claim. I'm saying my experience over the last 35 years, taking care of people who followed my program when they were 50, 60, or 70, right? They would have to be like 60 or 70 because they would still be alive today. These people are living, or they're, I could give you numerous people who have died around between 95 and 105 years old, who came to me in their 70s with advanced diseases, who lived, 20, 30 years longer. And I'm saying it's reasonable to suggest that looking at my investigative research into all these factors that govern human lifespan, and looking at the things that regulate human life, including how much cruciferous green vegetables people eat, because cruciferous green vegetables are linked in numerous studies to longer lifespan, particularly promoting the ability to be a healthy centenarian. But looking at all these plant-derived nutrients, the glycemic load of the diet, the caloric rush of the diet, the consumption of plant protein versus animal protein, the phytochemical load, the exposure to ergothioneine from mushrooms, having a favorable omega-3 fatty acid balance, in any case, the type of fat you're exposed to, your exposure to nuts and seeds, your salt exposure or lack thereof. In other words, all these parameters of enhanced lifespan, meaning we can look at various diets that people propose from all around the spectrum of dietary preferences. And we could say that compared to the standard American diet, giving that diet 0, just the average lifespan in America, if we want to see if a diet's going to be detrimental or helpful, we know that keto diets may be temporarily helpful, and a carnivore diet may occasionally be helpful for a person who has schizophrenia or a psychosis, because I'm not making a joke here, I'm serious here, because sometimes restricting carbohydrates very severely and going into very heavy ketosis can help a person with a brain injury or mental illness or seizure disorder. And that may be the only sensible indication for a carnivore diet. I'm not saying the carnivore diet makes you crazy. I'm saying it can be, or the people who would do it are crazy. I'm not making that joke. I'm saying that seriously, it might make sense in certain individuals. They might benefit, the risk of having a shorter lifespan may be worth it for having a better quality of life for them with those unusual illnesses. But for most people, they're getting about 5 or 10 years off their life, particularly the carnivore diet, maybe 10 years off their lifespan, the keto diet about 5 years off a lifespan, plant-based keto still positive, but better, and Mediterranean diet about 3 years additional lifespan, pretty decent. The fruitarian 10-10 fruitarian diets, pretty good, about 4 years increased average lifespan. Extremely low-fat diet, vegan or low-fat vegan, still good diet, still extending lifespan significantly, but not probably as lifespan favorable as a blue zone diet where they're getting more exposure to some beneficial fats, or particularly the 7-day Adventist blue zones who utilize nuts and seeds. And we know that the flexitarian, pescatarians in the 7-day Adventist study live longer than the vegans who were not eating nuts and seeds. And I'm saying the nutritarian flexitarians and the supplemented nutritarians were going completely vegan and then supplementing with those 3 particular important nutrients we're talking about, zinc, DHA, and B12, to gives us the highest potential to live the longest life possible, to that 95 to 105 range that I'm suggesting that I've been experiencing in my cohort of patients over the last 35 years. So here's a graph representing that. And this is not the hard science I'm presenting when I'm talking about the benefits of nuts and seeds or the dangers of a diet too high in animal protein, or this is, my review of 30,000 studies, my 35-year career, what I've observed, and also putting it together with the data showing what are the factors that make for longer or shorter lifespans. So I think that it's possible to push the envelope of even longevity and really feel much more protected, much more at peace, and to maintain your health span and your play span into your later years. So now we got to discuss the further talking about fat here is some of the, I could say, the information that I'm concerned about that I've heard at these conferences in the past. I once heard, I think it was last year, where I heard in a question and answer panel where somebody asked in one of the panels, the person questioned and said, my omega-3 index is 1. 1. That's like dangerously low. And is there anything problem with that? What should I do? And the 2 medical doctors on the panel, people who are well respected, said, don't worry about it. And I'm thinking to myself, don't worry about it. What data, what science do they have to come up with that opinion? Why should they be giving their opinion that's so contrary to the science and taking risks with this individual's life? They've got such a, they've got this agenda, this to promote that's not based on evidence. At least they could have said, I'm not sure. The evidence is controversial. We're not sure what you do. Maybe, but they didn't. They just act very definitive. And I was disturbed by that, because let's look at what the evidence does show here. Number one, we know that lower levels of omega-3 levels exposure increases risk of later life neurological diseases. And there's more than 20 studies that document this, maybe 50 studies. So we're talking about an increased risk of Parkinson's disease and essential tremor and cognitive decline or dementia, and also depression. So here's, of course, a few studies, but what I'm saying right here is, let's look at some of the corroborating studies comparing the levels consumed and the level in the blood of omega-3 index over time, and how that is associated with age-related cognitive impairment and brain shrinkage and dementia. And I'm saying here that even though the average American doesn't necessarily live long enough to get as much dementia as we would see. In other words, it doesn't matter that the average shorter living person has a different cause of dementia. Their cause of dementia might be phytochemical deficiency. Their cause of dementia might be eating fried foods or taking in, exposure to smoke, or their cause of dementia may be plastic exposure. But the cause of dementia of a real healthy eating person, and a real who's living a long time, is at high risk of omega-3 deficiency dementia. And I became eventually concerned about this in my early stages as a medical doctor, because I was caring for a vegan community. I was the doctor who attracted a lot of people in the plant-based community to develop problems. And my patients from the American Natural Hygiene Society, the American Vegan Society, back in many 20, 30 years ago, were not people who were eating junk food vegan diets. They were eating really healthy natural food diets. And so many of my mentors, people I respected in the natural hygiene movement, developed dementia or Parkinson's in their later years. And when I tested their blood, they were extremely deficient in omega-3 fatty acids. And I was concerned about that, concerned about prescribing and advocating a diet that allowed people to get demented or Parkinson's disease in later life. And so looking into this made me extremely vigilant to make sure that people made sure they had an adequate omega-3 index if they're following a diet with no seafood and no omega-3 exposure. And the data here from the studies, and here's some of them, overwhelmingly corroborate this with really almost no outliers. In other words, show me the studies that show that low omega index is safe if you follow people into past the age of 90. No such studies document that. We've lots of evidence to show it's unhealthy and shrinks the brain. So here's more references about it. In other words, the evidence is pretty overwhelming here, and it's important to know your omega-3 index. And here's a study that was supported with the money from the Nutritarian Research Foundation, Nutritional Research Foundation. And it took to 150 vegans and followed their omega-3 index who were not supplementing. And it found the vast majority were below 4, which is unfavorable. It also showed supplementation brought their levels up. But here's what I'm saying here. It showed that the vast majority of vegans, the very few of them could achieve adequate or ideal levels of omega-3 index without supplementing. Some people can, maybe a small percent, maybe 10% can, but 90% of people don't achieve ideal levels without supplementing. And some people's levels were so low that they could put themselves at extreme risk. I'm saying know your omega-3 index. Ideal is above 5.5. Here's some recent studies published in 2021 showing that a meta-analysis of 17 studies that those with the highest omega-3 index were about 15 to 18% based on the study, less likely to die over the 15-year of average follow-up, meaning that the lower levels of omega-3 index were associated with higher risk of both heart disease and cancer deaths. We're not just talking about dementia and protecting against dementia. We're talking about having an adequate omega-3 index leading to a longer lifespan. And then that study was corroborated with the next study, which showed that those with a lowest fifth or low omega-3 index averaged a 5-year loss of lifespan. That's equivalent to smoking a pack of cigarettes a day. So showing the longest lifespan occurred in people with a higher or adequate omega-3 index. So the evidence is overwhelming today. And I have to say, you have to be